Good afternoon, Lopez D'Souza. Let's begin the warm-up session. Describe your ability to handle high-pressure situations.
I have always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day, a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive, and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived, and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Do you think nurses should attend continuous nursing education?
Yes, I do. The Continuous Nursing Education Program helps nurses update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Your preparation time is over. You can now start your roleplay.
Hello, Mihiraa. Please come in and take a seat. It's lovely to see you. Could you please confirm the reason for your visit today?
Thank you. Sure, I am here for a routine antenatal checkup.
That's wonderful to hear. As part of your routine care, I also wanted to discuss the influenza vaccine with you. According to your records, it looks like you're due for it. How do you feel about having it today, Mihiraa?
Oh, I didn't realize I needed a flu shot. I thought I was already protected because I had that other vaccine for whooping cough a few weeks ago. Do I really need another one?
I can completely understand why you might be wondering about that. It can be confusing with different vaccines being recommended. Mihiraa, let me explain the importance of the flu vaccine, and we can talk about any concerns you might have. During pregnancy, your body's immune system is naturally altered to help protect and support your baby's development. While this is essential for a healthy pregnancy, it also means that your body may not be as effective at fighting off infections, which places you in a higher risk category for serious complications if you were to catch the flu. The influenza vaccine is the most effective way to protect both you and your baby. Immunization against the flu is crucial because the virus can lead to much more than just a bad cold. For pregnant women, a flu infection can increase the risk of developing severe complications like a high fever, which can be dangerous for your baby, or more serious conditions such as pneumonia. In some cases, contracting the flu can even increase the risk of preterm labor. By having the vaccine, you not only protect yourself from these risks, but also pass on important antibodies to your baby. This will provide them with a level of protection against the flu for several months after they are born, which is especially vital since young babies cannot be vaccinated themselves. Do you have any questions about this so far?
That makes sense, but I'm still a bit worried about having so many injections. What's the difference between this one and the other one I had?
That's a very good question, Mihiraa, and it's important to know what each vaccine is for. The vaccine you received previously was the Tdap vaccine. That one is a bacterial vaccine that provides protection for your baby against whooping cough. It is given during each pregnancy because the immunity passed on from you to your baby fades over time. The influenza vaccine, on the other hand, is a viral vaccine. The flu virus strain changes every year, which is why the vaccine is updated annually and recommended for pregnant women every flu season to ensure you have the correct protection. So, while both are important, they protect against completely different things.
I see the difference now. What about the side effects?
Mihiraa, I want to take a moment to talk about what you might expect after receiving the vaccination, so you feel fully prepared and know that anything you experience is likely a normal sign that your body is building up its protection. It's very common to have some temporary, mild reactions as your immune system responds to the vaccine. For many people, this includes a bit of soreness, redness, or perhaps some slight swelling in the arm where you receive the injection, much like a slight ache after a minor bump. You might also feel a little under the weather for a day or two, with feelings of tiredness, a mild headache, or even a low-grade fever and some general muscle aches, which can feel similar to the very early signs of a common cold. These sensations are generally a positive indication that your body is actively creating the antibodies it needs to keep you safe, and they typically resolve on their own within a couple of days. Resting, staying hydrated, and taking a simple pain reliever if you feel comfortable doing so can often help you feel better. However, it is so important that you listen to your own body. While these mild effects are normal, if at any point you feel significantly unwell, if your symptoms concern you, or if something just doesn't feel right, please don't ever hesitate to reach out for professional guidance. Making an appointment to speak with your GP or midwife is always the right step if you have any concerns that arise. They are there to support you and ensure you feel completely secure throughout this process. Speaking of your last one, how did you find the Tdap vaccination a few weeks ago, Mihiraa?
It was just a bit sore for a day or so, nothing too bad. My arm was quite sore. I was just worried if having another one so soon would be okay.
I'm glad to hear you didn't have a severe reaction. Mihiraa, based on our conversation today and reviewing your records, I can see you're being incredibly proactive about your health and the health of your baby by considering the influenza vaccine, and that's truly wonderful. I want to take a moment to reassure you completely about receiving this vaccine today. This vaccine has been extensively studied and is specifically recommended for pregnant women during any stage of pregnancy, whether you're in your first, second, or third trimester. It is perfectly safe for both you and your developing baby. A key reason for this is that the influenza vaccine does not contain a live virus. It is made from inactivated components, meaning it cannot give you the flu. It simply teaches your immune system how to recognize and fight the real virus should you be exposed to it, providing crucial protection for you both. I also note that you recently had your Tdap vaccine. There is absolutely no need for a waiting period between these two vaccinations. They work on different systems and can be administered safely even on the same day. The interval since your Tdap is more than suitable. By getting this shot today, you're passing on protective antibodies to your baby that will help keep them safe in their first few months of life before they can be vaccinated themselves. With all that in mind, and knowing this is a step to protect your well-being during this special time, are you happy to proceed with receiving the influenza vaccine today? Your comfort and consent are the most important part of this decision.
Yes, I think I am. You've answered all my questions, and I feel much better about it.
Wonderful, Mihiraa. We'll get that prepared for you now. Just let me know if you have any further questions.